read out that there are laparoscopic surgery ports. In case of laparoscopic surgery, these are the laparoscopic surgical ports, and this incision is the curved modified subcostal incision, that is called cave incision, and on the right side the subcostal incision is called the Cocker's incision. This one is the midline incision, and this part is the paramedian incision. So, midline incision, paramedian incision, Cocker's incision, cage incision, together with the port for the laparoscopic surgery, right? And just over the shorts, in case of a female, this one is the fan and steel operation. This is called fan and steel incision. Fan and steel incision. This is done for surgery of cesarean section, for oophorectomy, radical hysterectomy, and some orthopedic repair incision. This incision, that is the fan and steel incision, is utilized. All right. What? Just a line transversely above the symphysis pubis or the mons pubis, right? This one is the fan and steel incision, that is mostly utilized for caesarean section in our country as well as in the Western country, right? So, you can see, please read out what has been written here. All right. Now, you can see from the line from the umbilicus to the anterior superior iliac spine, at the 1/3 junction, the point is called McBurney's point, right? And this point is utilized in two directions. Number one in the oblique direction, number one in the transverse direction. The transverse line is called the Lange incision. The transverse one is the Lange incision, and the oblique one for appendixectomy, it is called gridiron incision. That is called gridiron incision. So, whatever is written out here, I have read out. All right, I have read out whatever is written out there. There you can see for splenectomy, these are the vessels at the hilum, and you need to tie out all the vessels entering into the hilum of the spleen and cut out the gastrosplenic ligament, splenocolic, linodenal ligament. All these ligaments are made to be cut out, and spleen must be made free after cutting, tying and cutting all the vessels that are entering into the hilum, right? In case of open surgery, these all whatever I have told are for open surgery, and for laparoscopic surgery, what we do, there are the ports. We put trocar, cannula, Sakar machine, all right, and other instrument through the ports, and then we first insufflate the peritoneal cavity, and when insufflation we do with carbon dioxide, the space is increased. The space within the abdomen that is accessible to us is increased. Then we place trocar, cannula, Sakar machine, all these things into the abdomen, and then we start operating, that is the tying, cutting, washing, all these things we start in laparoscopic surgery. But the thing is that you haven't ever seen any instrument for OT, that is laparoscopic instrument, you haven't seen, isn't it? You haven't seen laparoscopic instrument. Seen? Dekhecho tomra? No, number one. Number two is the all right. You haven't seen, number one, unipolar or bipolar instrument for cutting the muscles. You haven't seen. তোমরা দেখোনি, তাই তো? হ্যাঁ, এই যে মাসলটা সাবকস্টাল ইনসিশন রয়েছে ফর গলব্লাডার সার্জারি, অলরাইট। We cut this one, the skin incision, and then the muscle part is not cut through the scalpel, alright. What instrument is used? This is called an unipolar cutting instrument, electrical, right. And when we pass this through the muscle, the muscle is cut, alright. But you haven't seen. How can I explain this to you? Alright. And in case of brain surgery, you will be able to see the bipolar, the pincers like the bipolar instrument for taking out things from the brain, right. And in case of any surgery, you need to cauterize the bleeding vessels. You need to cauterize the bleeding vessels. Usually it is done with unipolar cautery, and in case of brain it is done with bipolar cautery. Understood? কথাটা বুঝলে তোমরা? যে এইখানটা কাটলাম আমি, ঠিক আছে? কি দিয়ে কাটলাম? একটা ইলেকট্রিক্যাল ইনস্ট্রুমেন্ট দিয়ে কাটলাম, নট থ্রু স্ক্যালপেল, right. And when the blood vessels are bleeding, the bleeding vessels are cauterized through what? Through an electrical instrument that is called the unipolar cautery. And for brain we use bipolar cautery, right. After separation of this muscle is separated out, right. Then we go deep to reach the gallbladder, right. Find the cystic duct. We find the cystic duct at the base of the Carrot's triangle. Usually we do not need to tie and cut the cystic artery. Cystic artery আমাদের বাঁধতে হয় না, কাটতে হয় না, usually লাগে না আমাদের, ঠিক আছে। What we do, we tie up the cystic duct and cut the cystic duct, right. And sometimes if we find stone in the CBD, common bile duct, then it is a tough surgery, because opening the common bile duct and taking out the stones from it is not a easy surgery. Opening the common bile duct and taking out stones from it is not a easy surgery, right. So what I have done, I have cut the muscles from here, entered into the abdomen. That is through the layers, as you know, external oblique, internal oblique, transversus abdominis, then the fossa transversalis, extraperitoneal fatty tissue, and the parietal peritoneum. Layer by layer you cut out and enter into the abdomen to reach what? To reach the cystic duct. What you need? You need to tie up the cystic duct. কি করতে হবে আমাকে? আমি যে ঢুকছি ভেতরে, why? What I will do? I will tie up the cystic duct and will cut it, right. And will take it out, take out the gallbladder. And sometimes what we need, sometimes we see that the CBD, common bile duct, is filled with stones. In that time we open the common bile duct, if possible take out some stones. If not possible, we put a কি বলে ওটাকে বলো, কোনো কিছু কেটে, কোনো ক্যাভিটি কেটে ওটার মধ্যে একটা টিউব ঢুকিয়ে দেওয়া, সেটাকে কি বলে বলো, আমি মনে করতে পারছি না, বুঝতে পারলে? একটা গলব্লাডারটা কাটলাম, ধরো এটা কেটে ওর মধ্যে একটা টিউব ঢুকিয়ে দিলাম, এটাকে কি বলে এই টার্মটা আমার মনে পড়ছে না, ঠিক আছে, অলরাইট, ঠিক আছে। সো কি বলে এটা মনে করতে পারছি না, ওকে, আই উইল মেমোরাইজ, ডোন্ট ওয়ারি। সো sometimes this is done through a midline incision. You see, this one is the midline incision. Midline incision is completed deviating it towards the around the umbilicus. We don't cut the umbilicus. We never cut the umbilicus. We deviate around the umbilicus. We deviate around the umbilicus and move towards the lower part, right? And in doing so, we need to separate out the rectus sheath as well as the rectus muscle, rectus sheath and the rectus muscle. If we take the approach from the lateral aspect, we will be able to save the nerves as well as the vessels that are entering into the rectus sheath. But if we take an approach, medial approach, we will not be able to save the arteries and the nerves that are entering into the rectus sheath. Do you understand? The nerves and muscles are entering from the lateral border of the rectus sheath. They are entering through the lateral border. So, if we enter through midline, then there will be cutting of the arteries and nerve, and it will damage the rectus sheath muscles, nerve and vessel. Not my point. What we need to do is to approach toward the rectus sheath from the lateral aspect, because the arteries and nerves all enter through the lateral border of the rectus sheath. What my point? And if we, that is the Cocker's incision, and this one from the anterior iliac spine and to the umbilicus, this is called the McBurney's line. This is called McBurney's line. And the 2/3, 1/3 junction, there is sometimes we take a transverse incision, that is called the lane incision, and sometimes we do take a oblique incision, which is called gridiron incision. That is called lane incision is the oblique, and the transverse incision is the, for appendicectomy, is the gridiron incision. All right. Thing is that you haven't seen any operation. That is the problem. You haven't seen any operation. What we do? We first cut the skin, superficial fossa, skin, superficial fossa. Then the external oblique is not cut. External oblique is not cut. Internal oblique is again not cut. These muscles are split. Then through a mosquito forceps, we take out the extraperitoneal fatty tissue and the parietal peritoneum. We check within the peritoneum whether anything is adherent to it. Then we make a small nick in the parietal peritoneum and extraperitoneal fatty tissue. Open up the peritoneal cavity, right? Then we search for where to go to find out the appendix. How to find out the appendix? What we do? The peritoneal cavity is open, right? Then we put 2 fingers towards the cecum. We go towards the base of the cecum, right? And search whether the appendix is there or not. What we do? We, through 2 fingers, we move towards the base of the cecum and look for whether appendix is there or not. If we find appendix is there, then we tie up the appendicular artery and the recurrent appendicular artery. They tie up those ends and cut the appendix, and the stump is put within the cecum. The stump is put within the cecum with a message. Omental patch. Putting one omental patch over the cut portion. The cut portion is pushed into the cecum, and that area is sealed by an omental patch. কি করলাম, কাটলাম ওটাকে, ঠিক আছে, অ্যাপেন্ডিকুলার আর্টারি, রিকারেন্ট অ্যাপেন্ডিকুলার আর্টারি কেটে দিয়েছি, ঠিক আছে, টাই আপ করে কেটে দিয়েছি। এবার এই যে স্টাম্পটা রইল, সেই স্টাম্পটা, দ্যাট স্টাম্প ইজ পুশড ইনটু দ্য cecum, right, and on that area a piece of omentum is put so that cecum doesn't get a leak, so that cecum doesn't get a leak. Similarly, in gallbladder surgery, what we do after tying up the cystic duct and cutting up the gallbladder, what we do, we put a coagulating cloth, surgical cloth, that is called Surgicel. We put the Surgicel towards the gallbladder so that there is no leakage of gallbladder within the peritoneum. That is called Surgicel. Right? We put a piece of Surgicel to prevent any bile leakage into the peritoneum. So this is the Cocker's incision for gallbladder surgery. This is paramedian incision. This is laying and gridiron incision. This I haven't told. That is the subcostal incision for splenectomy, and this one is the phalansteal incision for number 1 for cesarean section, for hysterectomy, oophorectomy, sometimes orthopedic surgery, and sometimes for nephrectomy. All these surgeries can be done through this phalansteal operation, right? This phalansteal operation full name is Hermann Johannes Phalansteal. This is the full name, full German name, Hermann Johannes Phalansteal. This is the full German name for this incision, and this incision subserves enough space for the pelvic surgery as well as the gynecological surgery. So McBurney's incision, what is this one? Transverse line, it is done. Midline incision, phalansteal incision, Seifert process, laparoscopic surgery. Now, Seifert process makes an important, needs an important comment, right? The Seifert process, from inside the diaphragmatic fibers come out, right? And from the liver, if there is a liver abscess, that will also present at the epigastrium deep to the Seifert process. Remember the term. If there is a liver abscess, this will also come under the origin of diaphragm at the Seifert process. Got my point? So we do not do, we usually do not cut the epigastric region of the linea alba. What is this in the midline? That is the linea alba. So what we do not do, we do not cut the midline region of the linea alba to prevent any cut or injury to the liver abscess or fibers of the diaphragm. Got my point? I take a rest, conclude it, and if you need to know anything from me, you can ask. All right? You can ask. Thing is that you haven't seen any surgery. So if I tell something, you will not be able to translate or transform it into your idea, your knowledge. Right? তোমরা বুঝতে পারবে না কি বলা হচ্ছে, সেটা বুঝতে পারবে না, কেন না তোমরা সার্জারি দেখো না, অ্যাপেন্ডিসেক্টমি দেখো না। এই যে স্প্লিট করা, হ্যাঁ, এক্সটার্নাল অবলিককে স্প্লিট করা হলো, ইন্টারনাল অবলিককে স্প্লিট করা হলো, মস্কিটো দিয়ে আর্টারি ফরসেপ দিয়ে ফাসা ট্রান্সভার্সালিসকে কেটে ফেলা হলো, তারপরে এক্সট্রা পেরিটোনিয়াল ফ্যাটি টিস্যু অ্যান্ড প্যারাইটাল পেরিটোনিয়ামকে এরম করে হোল্ড করে নেওয়া হলো টু সি ওয়েদার দেয়ার ইজ এনি অ্যাডেশন অর অ্যাডহেয়ারিং সামথিং, দেন উই পুট আ স্মল নিক। তারপর এই পেরিটোনিয়ামটা কী করা হলো, এটা দেখে নিলাম এর উপরে চেক করে তলায় কিছু লেগে আছে কিনা, then we put a small nick and then open up the peritoneal cavity. All right. Thing is that you haven't seen this thing, so you need to understand. Number one, what will you do? Number two, if following gallbladder surgery there is gall within the peritoneal cavity and there is swelling, and the patient is asking that I am having irritating pain in my right hypochondrium, then what will you do? These are the things you need to know. You by this time you do not know these things because you haven't seen any surgery. So when you will be doing your surgical classes, then you should have these questions in your mind and try to find the answer for this. Got my point? You need to know if the gallbladder is leaking, what I need to do. If the patient says that I am having pain in my appendicular region, what you have to do. All right. Thank you all for patient hearing.